We want to dive a little deeper into something that we've been talking a lot about lately, Princess Kate's cancer diagnosis. So last week, the princess said she was in the early stages of preventative chemotherapy after her abdominal, I can never pronounce that word, surgery in January. So here to talk to us all about that and some other big health headlines, we've got our very own Dr. Coley. Thank you so much for joining us. You were with us, Dr. Coley, yesterday when we kind of found out in real time what was happening with Kate, and you provided a lot of insight then, but that was also in real time. So now we can kind of unpack it. What is preventative chemotherapy? I know a lot of our viewers have been asking this very question, and what does that treatment entail?
Yeah, you know, Kate used that term, but it's not really a medical term. In medical literature, we call it adjuvant chemotherapy because it's an adjuvant to the surgery. So you do the surgery, you take out whatever you can see, and the point of the chemotherapy is to sop up sort of the microscopic cells. Now, we don't know what type of cancer Kate has, so we don't know exactly what regimen she's getting, but it could really vary depending on the type of cancer that she has.
Okay, well, I mean, you know, experts are calling Kate's diagnosis part of what experts are calling an early onset of cancer epidemic. Do you have any theories as to why young adults are now being diagnosed with this disease? Like, have you seen this throughout your career, or is there a spike?
No, it's been actually over the last several decades that we've seen this, and you know, cancer used to be a disease of aging, because how do you get cancer? The cells make mistakes as they're replicating, so when they replicate more times, that's when the cancer develops. Now what we're realizing is that early in life, whether it's our childhood or our adolescence, we're getting exposed to lifestyle factors, whether it's obesity, lack of exercise, more alcohol, more marijuana, what we're eating in terms of processed foods, changing our gut and the bacteria that live there, that's actually changing our genetics and changing our risk for cancers. And we're seeing it across the board in terms of not just the United States, but the world, and different types of cancers. A lot of these are cancers of systems that are involved in getting rid of toxins. So GI cancers, colorectal, gallbladder, pancreatic, and then also GU cancers as well, bladder, urinary tract cancers, etc. So I really do think it's a wake-up call for us, but it is also a reminder that screening is so important, because just like with Kate, cancer can be asymptomatic. Her cancer was sort of found during other surgery, and you know, we wish her the best. Hopefully the chemotherapy will be something that's not too harsh on her, but it can have many of the same side effects that regular chemotherapy has, because that's really what this adjuvant chemo is. So she could experience weight loss, fatigue, nausea, many of those types of problems.
It makes me circle back to something you said last week, Erica, about like fighting for your advocacy for screenings.
Right.
And even if your doctor, who you trust, as you always should be like, oh, we'll wait till next year. If you feel like you need to be insistent, go ahead and do that.
Amen.
Yes.
Yeah.
Okay, so we're going to switch gears a little bit here. The Supreme Court is hearing a big case today. It's all about access to an abortion pill. Is this the same thing as Plan B?
It is not the same thing. In fact, an abortion pill is used by the medical community to get rid of miscarriages, to have any types of terminations of pregnancies that are medically indicated. Now, some of those are for choice as well, but it's been something that's been used so commonly. So 63% of all medical terminations, 63% of terminations last year were medical terminations. And to take this away or to limit access to it, which is what this particular case is trying to do, it makes me really, really nervous.
So then let me capitalize on this moment, because I will speak about Roe v. Wade and access to health care for women, and then I'll always get back, oh, the Democrats want to go back to having abortions at 9 months. I've never heard of that before. Can you please speak as a medical doctor about an abortion at 9 months inside a hospital?
Yeah, I mean, abortion at 9 months is not what we're talking about here.
But it's not even a thing unless, of course, the fetus is not viable and the mom is...
Right.
People
do not perform late-term abortions unless, like you said, it's a threat to mom or a threat to baby, or the baby is already passed, so to speak. But what we're talking about here is early terminations. We're talking about women who are going to miscarry anyways. And the American College of Obstetrics and Gynecology has come down hard on this with a very definitive statement saying that if this case was won and we limited not just when you can access it, but who can access it, you're really going to impact women of color, women of poor socioeconomic status, people who live far away from medical care, and you're going to potentially limit access to the most effective way to terminate a pregnancy in the privacy of your home.
Oh my gosh, Dr. Coley. Wow. All right. Well, please, everybody, DBL Nation, follow Dr. Coley on social media, Pyle Coley MD. Also, be sure to subscribe to her YouTube page and check out her podcast, Heart of Medicine, wherever you listen to your podcast. Thank you again, Dr. Coley. We appreciate you.